Gentlemen, let me ask you something. Have you noticed that what used to take 5 minutes now takes 20? Or maybe you've lost sensation in intimate areas, so you increase intensity and pace, but the satisfaction just isn't there anymore? Perhaps you've started avoiding this wellness practice altogether because you're not sure what's normal, what's safe, or whether your body is letting you down. Here's the truth most doctors won't tell you. After 60, the approach you've used for decades regarding intimate wellness may actually be creating problems. Reduced sensation, tissue damage, even long-term frustration. The techniques you learned years ago are now working against you. I'm Dr. Lila Romano, a board-certified urologist with over a decade of experience helping men age with strength, confidence, and vitality. Today, we're talking about how to maintain intimate health safely after 60 and the 3 big mistakes you need to avoid. If this is the honest, shame-free guidance you've been looking for, hit that like button, comment where you're watching from, and subscribe. I share practical, evidence-based advice for men who want to take care of their health and confidence without embarrassment. Let me be clear right from the start. Solo intimate wellness is not just okay. It's healthy. Especially after 60, gentle self-care in this area is one of the most beneficial ways to support your overall health. Here's why. Regular practice maintains blood flow to intimate tissues, which is critical for tissue health. It supports prostate function by promoting circulation and reducing congestion. It lowers stress hormones like cortisol, improving sleep quality. And it helps you stay connected to your body, which is essential for emotional well-being and confidence. But here's what most men don't understand. Your body after 60 doesn't respond like it did at 25. And there's no shame in that. This isn't dysfunction. This is biology. Your skin becomes thinner. Nerve endings respond more slowly. Blood vessels become less elastic. Recovery takes longer. This means your approach needs to evolve. It's no longer about force or intensity. It's about presence. Tuning in and listening to what your body needs now. Treating yourself with care, not like a machine that needs fixing. When you make that shift, something powerful happens. You feel more connected, more relaxed, genuinely satisfied. But most men never make this adjustment. They keep using the same rush techniques, the same excessive pressure from decades ago. And that mismatch creates real problems. Over my decade in urology, I've worked with hundreds of men in their 60s, 70s, and beyond who came frustrated or embarrassed about changes in their intimate function. And I've discovered they're making the same 3 common mistakes. Let's talk about them. Mistake number 1, rushing. So many men treat this wellness practice as something to get over with quickly. You wait until you have 5 minutes alone, lock the door, and rush through it as fast as possible. But here's what's happening in your body when you rush. Your nervous system stays in stress response mode. Your heart rate spikes, but not in a relaxed way. More like an anxious, urgent way. Blood vessels constrict instead of opening. You might hold your breath without realizing it. Instead of receiving nourishing blood flow that supports tissue health, your body stays in alert mode. This prevents true arousal. It reduces satisfaction. And over time, it trains your brain to associate intimate contact with tension instead of pleasure. Every rushed experience reinforces a pattern that says intimacy equals stress. And that pattern affects everything, including intimacy with a partner. So what's the fix? Slow down. Intentionally. Even 5 or 10 extra minutes makes an enormous difference. Before you begin, take 3 or 4 deep, slow breaths. Turn off your phone completely. Make sure your door is locked and you have true privacy. Give yourself permission to fully arrive in this moment. You don't need candles or elaborate rituals. What matters is that your body feels safe. Because when it does, something remarkable happens physiologically. Your blood vessels dilate. Your parasympathetic nervous system takes over from fight or flight. Nerve endings wake up and become responsive. Sensitivity returns, often in ways you haven't felt in years. You experience real satisfaction instead of just physical release. This is vascular biology. When you're relaxed, your body releases nitric oxide, the same molecule that certain medications work on. Nitric oxide tells blood vessels to expand, allowing oxygen-rich blood to flow where you need it. But stress and rushing shut down that entire process. Slowing down isn't indulgent. It's working with your biology instead of against it. That's the first crucial change. But even if you take your time, the second mistake can undo all those benefits. Mistake number 2, using too much pressure. This is incredibly common, and I understand why. As sensation decreases with age, the instinct is to compensate. You increase pressure and force, thinking if you apply more intensity, you'll get that feeling back. But your intimate anatomy is not designed for excessive force. It's made of delicate vascular tissue with sensitive blood vessels and fragile nerve endings. When you apply excessive pressure repeatedly, you create real damage. You cause microscopic tears. You create irritation and inflammation. You desensitize the very nerve endings you're trying to stimulate. Some men develop what's called death grip syndrome, where your body only responds to one very specific, intense pressure, usually your own hand. And here's the problem. A partner's body cannot replicate that pressure. So if you've conditioned yourself to need that specific intense stimulation, natural intimacy feels like nothing. I've had patients who can achieve erections and technically function, but feel almost nothing. And it almost always comes back to grip pressure. Here's what to do instead. Loosen your grip significantly. Use only your thumb and 2 fingers, not your entire fist. If your fingernails turn white from pressure, you're gripping too hard. Here's a test. If you can't comfortably hold a pen with that grip, it's too tight for masturbation. Lubrication becomes essential. Choose a natural, unscented lubricant. Water-based options like Sliquid H2O or Good Clean Love are gentle and easy to clean. Silicone-based like Uberlube lasts longer for extended sessions. Avoid anything with glycerin, parabens, or fragrances. Use a generous amount, more than you think you need. Warm it between your palms for 30 seconds before applying, and reapply every 5 to 7 minutes. If you feel any friction, add more immediately. Here's the mindset shift. Stop focusing on outcome. Focus entirely on sensation. Ask yourself, how does this feel right now? Think of it as therapeutic touch, a massage for your circulatory system. Experiment with different techniques. Try circular motions instead of stroking. Use your palm instead of fingers. Vary the area of focus. Different nerve pathways respond to different stimulation. This might feel less intense at first. Your nerves have adapted to high pressure, but research shows that with consistent practice over 3 to 6 weeks, sensitivity genuinely returns. You'll feel more with less pressure. When that happens, self-pleasure becomes more satisfying and transfers directly to partnered intimacy. Your body relearns how to respond to natural, gentle stimulation. This is neuroplasticity in action. So we've covered slowing down and loosening your grip. But the third mistake is the one most men never expect. Mistake number 3. Ignoring your emotions and warning signs. Let me break this into 2 connected parts. First, the emotional component. Many men carry quiet shame around sexuality for decades. Maybe you were told masturbation was wrong. Maybe you absorbed cultural messages about sex. Or maybe you feel uncomfortable about your aging body. Emotional stress, guilt, and shame don't stay in your head. They settle into your body. They create muscle tension, especially in your pelvic floor. They trigger shallow breathing. They activate fight or flight response, which shuts down arousal. When you approach self-pleasure with guilt or anxiety, your body cannot relax enough for genuine pleasure. Blood vessels stay constricted. Nerve sensitivity decreases. Even if you achieve release, it feels empty. Second, ignoring physical warning signs. After 60, your body changes. 50% of men in their 60s have benign prostatic hyperplasia. 1 in 8 men develop prostate cancer. Early symptoms are subtle and dismissed as normal aging, but they're not always normal. Pay attention to these signs. Any pain during or after ejaculation, especially if it's new or worsening. Any blood in semen, even trace amounts. Changes in ejaculate appearance. Unusual color. Big changes in consistency. Sudden volume decrease. Burning or difficulty urinating after. Swelling that doesn't resolve within hours. Sudden difficulty achieving orgasm. Any lumps or hard areas you can feel. These aren't things to be embarrassed about. These are signals your body needs medical attention. So what's the fix? For the emotional component, start with self-compassion. You're not broken. You're not past your prime. You're in a new phase requiring different care. That's wisdom, not weakness. Give yourself permission to reconnect slowly, without pressure. Let go of comparing yourself to who you were at 25. Focus on who you are now and what feels good now. If you're carrying deep shame you can't shake, talk to someone, a doctor, therapist, or trusted friend. You don't have to figure this out alone. For warning signs, the fix is straightforward. Pay attention and act. After every session, do a quick check. Did anything hurt? Did you see anything unusual? If something feels off, make an appointment. Here's something many don't know. Regular ejaculation protects your prostate. A large study in the Journal of the American Medical Association found that men ejaculating 21 or more times monthly had 33% lower prostate cancer risk compared to 4 to 7 times monthly. The mechanism makes sense. Your prostate constantly produces fluid. When it sits stagnant, it becomes inflammatory. Regular ejaculation flushes those ducts, clears debris, and maintains healthy circulation. This isn't just about pleasure. This is preventive medicine. When you release shame and pay attention to your body's signals, everything shifts. Biologically, stress reduction allows proper blood vessel dilation and nerve response. Emotionally, it restores dignity and connection. Practically, it turns self-pleasure from a rushed, anxious act into a mindful, restorative practice. Now let me walk you through the complete protocol I give my patients. Start with preparation. Wash your hands, have fresh towels, choose a private space, lock the door, put your phone on airplane mode in another room. The room should be comfortably warm, 72 to 75 degrees. Lighting should be soft. Start lying on your back with a pillow under your hips. This improves pelvic blood flow. Before touching yourself, spend 2 minutes on breathing. Use 4-7-8 technique. Breathe in through your nose for 4 counts. Hold for 7. Exhale through your mouth for 8. Repeat 3 or 4 times. This activates your vagus nerve, switching your body to rest and digest mode. Then progressive muscle relaxation. Starting at your feet, tense each muscle group for 5 seconds, then release. Move through calves, thighs, abdomen, chest, arms, jaw. This releases stored tension. Spend 3 to 5 minutes on non-genital touch, chest, abdomen, inner thighs, arms. This is neurological preparation. You're telling your nervous system this is safe, not urgent. This spreads arousal throughout your body, making eventual stimulation more satisfying. For lubrication, choose based on your needs. Water-based is gentle and cleans easily. Silicone lasts longer. Avoid glycerin, parabens, or fragrances. Take a generous amount, 3 or 4 pumps. Warm it between your palms for 30 seconds. Apply thoroughly. Reapply every 5 to 7 minutes. When you begin genital stimulation, use only thumb and 2 fingers. Keep grip light, about 50% of what you're used to. Remember the pencil test. For speed, try counting 1-2 up, 1-2 down. About 2 seconds each direction. This is slower than your instinct. Trust it. Every 3 to 5 minutes, change something. Grip style, area of focus, motion type. Different nerves respond to different stimulation. Keep mental focus on physical sensation. Notice temperature, texture, feeling. When your mind wanders, bring it back to what you're feeling. After finishing, gently clean with warm water. No harsh soaps. Pat dry. Within 10 minutes, apply a warm compress to your perineum for 5 minutes. This increases prostate circulation and reduces inflammation. Drink 8 to 12 ounces of water. Within 15 to 20 minutes, urinate. This flushes your urethra and reduces infection risk. Do a quick self-check. Any pain, blood, unusual swelling, burning urination? Note these and discuss with your doctor if they persist. Let's talk about what to expect and when. In the first week or 2, this is an adjustment. New techniques feel awkward. Lighter pressure seems less intense. This is normal. You're retraining decades of habits. Just stay consistent. By week 3 or 4, you'll notice real changes. Nerves adapt to lighter pressure. Arousal becomes easier. You feel more sensation, not less. Techniques feel more natural. This is when patients tell me, I'm starting to get it. Between weeks 6 and 8, you'll notice vascular improvements. Erections feel firmer. refractory period might shorten. You may see more morning erections. Orgasms shift from just genital to more full body. By 3 months, the new approach feels natural. Your emotional relationship with sexuality feels healthier. If you have a partner, benefits often transfer to that intimacy. This isn't about getting back to 25. The goal is becoming the healthiest version of yourself at your current age. That's absolutely achievable. Before we finish, important medical warnings. Stop immediately and seek urgent care if you experience sudden sharp pain, any visible blood, erection lasting over 2 hours, priapism emergency, dizziness, chest pain, or severe testicular pain. See a doctor within 48 hours for blood in semen, painful ejaculation persisting, swelling not resolving, burning urination, urethral discharge, sudden difficulty with orgasm, or ejaculate changes. Be cautious if you've had recent surgery, wait 4 to 6 weeks, have an active infection, abstain until cleared, have Peyronie's disease, extremely gentle only, or recent cardiac events. Get clearance first. If taking blood thinners, use extra gentleness. Alpha blockers may cause retrograde ejaculation. This is normal. Antidepressants commonly delay orgasm. It's a known side effect. Let's bring this together. We've covered 3 critical mistakes: rushing and treating it like a stressful chore, using too much pressure causing tissue damage, and ignoring emotional shame and physical warning signs. I've given you the complete protocol: how to prepare your environment and mind, exact technique, light grip, generous lubrication, slow varied movements, focus on sensation, post-activity care supporting prostate health, and the realistic timeline: adjustment in weeks 1 to 2, real improvements by weeks 3 to 4, vascular improvements by weeks 6 to 8, full integration by 3 months. Your sexuality doesn't end at 60. It evolves. When you approach it with knowledge, patience, and self-respect, you can maintain pleasure, confidence, and prostate health well into your 70s, 80s, and beyond. This isn't about chasing who you were at 25. It's about honoring the body you have now and giving it what it needs. That's wisdom. Every mindful touch reinforces that you still matter. Your pleasure matters. Your health and dignity are worth protecting. Gentle, intentional self-pleasure after 60 isn't selfish. It's self-respect. It's preventive medicine for your prostate. It's maintenance for your vascular system. When you approach it with care, your body rewards you with better circulation, maintained sensitivity, and genuine well-being. If this information was valuable, drop a comment and let me know where you're watching from. This is Dr. Lila Romano, and I will see you in the next video.